about mid-December of 2020, we all contracted COVID together in our household, but I was the one who needed the hospital care. So literally, right out of the doctor's office, we drove to the Grace Hospital, and that's where my wife dropped me off. So no time to pack a bag, no time to say goodbye and see the kids or things like that.
Working in the ICU, I have seen a significant change in our work environment. We are being pushed to take care of not only one, but two critically ill COVID patients.
Family and friends are such an important part of an individual's healing journey, and they're absolutely critical to that. So it really breaks all of our hearts to have to follow what's necessary to protect the all.
We hear stories of our healthcare aides and our nurses and our physicians stepping up and being family members, surrogate family members. They're, when you're in an ICU bed with no visitors allowed, somebody's got to provide that compassion. Somebody's got to provide the care and the loving touch.
It's a very strange thing to be dropped off, not know for sure whether you're going to see your family again. When I came into that emergency room, it seemed like every square inch of that place was being used. And I knew that the only reason I was whisked off to my own private space was because I was positive for COVID.
There was this one patient that I could not forget. Before she was struck with COVID, she was independent with her activities of daily living. She made it clear that her wishes would not be saved by any mechanical means. So when she was dying, we did not leave her side, and we were just like what was there with her during that time. So that was really sad.
Staffing in critical care areas like ICU and Emerge for all of the acute care hospitals, St. B, HSC, and ourselves, is challenging. But it was particularly challenging to all of a sudden need to staff additional beds. And our staff, as usual, rose to the challenge.
The focus has become less on hard things and more on soft things, more on enhancing patient care by helping staff, by relieving patients, relieving staff of a heavy workload that they've been carrying for 15 months.
What looked like a bit of an army camp where people are just being triaged and dealt with and whisked off to wherever they need to be going to. People hurting, people moaning, people scared themselves for what's about to happen next for themselves. My lungs were heavy. The back of my lungs, not so much the front, but the back of my lungs. There was this regular kind of deep ache in them. Your lungs are fighting for air. Your oxygen levels are dropping. Even now, I've got a little bit of shortness of breath still.
Our ICU team are composed of hardworking. We are resilient. We work together as a team, and we help one another.
Knowing people were still pretty tired from wave one, we did have a bit of I don't think the lull is the word, but a period where numbers certainly decreased a bit in the summer, and then they ramped up again for wave two in the fall.
Think about the staff that come into this hospital that when they leave have to go home and face their families, not knowing that they may or may not have been exposed to COVID. It's a daily grind that hopefully as the foundation we've been able to help them ease a little bit just by providing something small like an ice cream sandwich or a piece of pizza.
Aside from dealing with all the ramifications of trying to get better from COVID, the care that I received at the hospital was fantastic. I have a great deal of respect for nurses and doctors and what they have to do, even before what I went through. What they do to help patients on a regular basis is often unsung. People just don't see it.
The community has been absolutely amazing. Everything from letters from schools just to tell us that they're thinking of us and to thank us. Each and every one of those we've posted, we've shared widely with the staff in the various forums we have, to the wonderful donations of meals.
Princess Auto approached us and asked if there was something they could do to help, and could they provide some meals. And we said, sir, sure, that'd be wonderful. But little did we know that their intention was to provide 200 meals a day, 100 for day shift, 100 for night shift, for the months of January and February. 11,500 meals served to staff here at the Grace Hospital. How do you value that? You know, no tax receipts, it's just out of the spirit of the Princess Auto Foundation. And we've had other people that, you know, did the same thing. I mean, all these local community groups, we've had drive-bys, we've had all of the, you know, the firefighters, the paramedics driving by, the police service.
And the smiles on people's faces, the appreciation, one less day that I have to think about bringing my lunch, or, you know, they're already tired when they're going home at the end of a really long shift and they're coming back tomorrow. One less thing to think about and have to worry about, and someone's thinking about us.
You know, it's just been an incredible experience unfortunately in a negative environment, but a very positive experience to see what the true spirit of our community of Winnipeg is.